From your breaking news and weather authority, this is 13 Wham News This Morning on Rochester's CW.
Well, she is known as the fastest woman in the world, a 3-time Olympic gold medalist and 14-time world champion. But Gail Devers was almost sidetracked by thyroid disease. She joins us this morning to talk about how she conquered it and how you can get help. She's joined by Dr. Jeffrey Garber. He's a thyroid expert. Thanks for being with us.
Thank you for having us.
Gail, I've got to ask you, so you accomplished all of these things, many of these things, while you were diagnosed with thyroid disease. You know, for most people, just doing what you do in general is amazing, as an amazing feat. But to do it with thyroid disease, how did you do that?
Amazing luck. No, you know, it took almost 3 years for me to be diagnosed. I had a lot of symptoms, and that ranged from dry hair, brittle nail. I had lost a lot of weight. I was under 80 pounds at my worst.
Wow.
And the bulging eyes, I had the goiter, and nobody could figure out what was wrong. I went through a series of doctors, and there just was not a proper diagnosis at that time, and it was a chance meeting with a UCLA team physician that actually gave me a simple TSH blood test and diagnosed that I had Graves' disease, and from there it was just getting my life back on track.
So for people who are watching, you had an underactive thyroid or an overactive thyroid?
I had an overactive thyroid in the beginning, and then when I went through my radioactive iodine treatment, it went from hyperthyroidism to hypo, so I went from under 80 pounds to 140 pounds. So,
wow.
And it's just a matter of, you know, we talk about it all the time, consistency, and that's why you need to make sure that you're on the right medication, that you're asking for the right refill, checking it to make sure, and that you keep testing yourself regularly to keep on the right dosage.
Doctor, I'd like to bring you in on this. For a lot of people like Gail, you know, they think maybe, oh, I'm just tired, or, you know, that whole sluggishness thing. But, you know, but in reality, that's a serious thing. I mean, and having thyroid illness, what are some of the complications from that?
Well, you've heard about them from Gail, and it's extreme. It can actually stop you in your tracks, literally, as it did in her case. It can affect your heart, it can affect your muscles, your ability to breathe normally. Virtually every organ system is influenced under normal circumstances by the thyroid, and when it's not working properly, every organ system can malfunction. We're made up in a complicated fashion, so our weak points vary, but anything goes. And in fact, because anything goes, it can actually be very difficult to diagnose because it can be attributed to a whole host of other reasons.
So either hypo or hyperthyroidism is something that needs immediate medical treatment, isn't it?
Well, it's a question of degree. Her case was actually rather severe, and if it weren't for her terrific good health before, she wouldn't have stayed out of a hospital as long as she did. But other people would have ended up in a hospital before they were diagnosed if they were afflicted to the degree she was.
So go get a test. That's the big key here. Go to your doctor, right?
Be aware and alert your doctor to it, particularly if you're a woman with a family history of thyroid disease or other autoimmune diseases, that is, diseases that wherein your body attacks portions like lupus, rheumatoid arthritis, or type 1 diabetes.
Yeah. Okay, Gail, do you still have the nails? I have to ask.
No, I cut them every 3 years, and so they're kind of short right now. But
okay.
There's a reason. There is a reason. Usually, because it took me 3 years to be diagnosed, I let them grow for 3 years because that was a sign for myself that I was okay, and now every 3 years I cut them. So you happen to catch me at my 3-year cut time.
They still look pretty long to me, and thank you so much. What are you busy doing these days? We've got a couple seconds left.
I have 2 daughters. I have a 5-year-old and a 2-year-old, and they keep me quite busy. And for me, it's just, you know, I think I went through what I had to go through to educate other people, to let them know that education is the key. And we're even telling people that there's a website. We have powerofprevention.com. Go out there, get that education, talk to your doctor, and get that TSH test so you can get your life back on track like me.
Powerofprevention.com. Thank you so much, Gail. We appreciate it. Doctor, thank you for your advice.
Thank you.
Thank you.
This show is so neat. You get to talk to some of the neatest people that you watch, you know, and make headlines.
Yeah.
Really cool.
Yeah.
All right, coming up next are Crime Stoppers Most Wanted. We ask your help finding a fugitive.
We'll be right back.